Today we'll discuss about the practical and clinical utility of Miasm. In this process, I would like to introduce you how we can manage the cases by using the miasmatic theory of Master Hahnemann. When patients come towards us, so they have lots of problems. In the aphorism number 80, Master's guidelines are very clear about the miasmatic interpretation of the cases of various types. In the theory of chronic disease 2, Master Hahnemann describes in detail about the details of this miasm. So in this journey, I would like to tell you very practical and clinical utility of miasm step by step. So don't be hurry, just be patient. I would like to introduce you very clearly. So in the miasms, so Master Hahnemann classify miasms in the three categories, that is the sora, psychosis, syphilis. So in the sora, so Master classify it again, the latent sora, the secondary sora and primary sora. In primary sora, all the cases of primary manifestation of each disease included into the primary sora. So what is the primary sora? So in the primary sora, let me introduce a very simple cases. So accordingly, you can get understanding of the clinical utility of this sora. So first of all, I would like to tell you about the case. So patient came towards me about complaining that there is a severe itching, ringworm, or sometimes he may suffering from very bad eruptions around the genitals, around the neck, around the hands, so where it may be, or these infections are catch at whenever they live in hostels or in a very crowded place, or either into the infected persons they are contacted with that. So this is the very highly contagious disease, as Master said. When you read the theory of chronic disease, so Masters gives the more than hundreds of explanations and proofs about that the primary itch. So in that there might be a leprosy, there might be a tinea, or there might be a scabies. But most of the time, after completion of the skin eruptions or itch disease, and whenever somehow we suppress it by other means of allopathic ointments or any medications, then there is a patient landed into the secondary sora slowly or directly. It may be or might be. So when patient came towards you about the primary manifestations of this disease, so we need to focus accordingly to the miasmatic theory. When we are not using the miasms, so then we are not able to treat the cases. For example, in another type of case, I would like to explain you about the syphilitic miasm. So whenever patient came towards you about the primary chancre, just soon after the contact, whenever he suffer from this type of chancre disease, so at that time, this is also a primary syphilis. So similarly, likewise, whenever patient have a sexual contact and he gets suffering from this gonorrheal type of or condylomatous type of infection into the genitals, so this is also a primary type of infections. So whenever you are able to diagnose it, all these three are the primary stages of miasms. So we need to focus on to the understanding of miasm theory of Hahnemann. And if we are denying all these things, we are not able to treat it. In these cases, Master's guidelines for management of all these three miasms in the primary stage, we need to treat the symptoms accordingly. Sora with the sulfur, thuja with the psychosis, and Merxol with the syphilis. If we can use these drugs in a LM potency frequently according to the case, so we should have guaranteed and 100% results in each and every case of disease. But if you are not follow all these protocols of Master's teachings, so you are not able to cure anything. So friends, this is all about the primary sora. About the secondary and latent phase, we'll discuss into the next video. Thank you.